Intervening. Strategies that work. Now that we have broken the problem down, we can more clearly see the chain of events that affect it. Where should we intervene? If you look at the end of the roadmap, the contributing factors farthest to the right, here is where you have more control and can take action. For example, you can implement practical steps to extend the hours of the health clinics on vaccination days. But is this the best place to intervene? This depends on your situation, the knowledge, technology, and resources available to you. Based on this information, you can decide where you'll have the greatest impact for your effort.
We know that mothers can get to the clinics, but why don't they return for the measles vaccination? We have looked at 3 possible interventions. Focus groups reveal that mothers aren't aware that measles is a danger to their child. They are also confused about when their child should get the vaccine. If we can effectively communicate this information and also praise those mothers who bring their children in, then coverage will increase and the mortality rate will be reduced. Mothers also complained that they were treated rudely by staff at the health clinics. There were long waits and few opportunities to ask the health workers any questions. But the staff is overworked, underpaid, and the conditions are stressful. Should we design a training program that goes beyond vaccination techniques to counseling health workers on how to interact with patients? Or would it be better to intervene at an organizational level and find ways to help manage the patient flow? For example, by creating a separate line for immunizations. After a lot of discussion, we decided that if we improve patient flow at the clinics so that mothers don't have to wait so long to get their child immunized, then more mothers will come back for the final vaccination. Coverage will increase and there will be less children who become sick and die from measles. It's not that the other interventions won't work, but resources are tight. And to change the attitudes and behavior of health workers and mothers will take more staff and funding.
Once you've selected an intervention path, you need clear objectives which state what you expect to change at each step of the way. You need to ask, what is the level of this problem today, and what do you want it to be in the future? For example, we know there are long waiting lines at the health clinics. Currently, the average waiting time is 2 hours. We can develop an objective by asking 2 simple questions: how much and when? In this case, we will reduce the waiting time to 1 hour by next year. The objective is directly linked to the factor we want to change. We need to assign objectives for each step along our intervention path. We call these outcome, impact, and process objectives. By defining our expectations, we set a standard by which to measure our progress. Then by looking at the process objectives, we can develop an actual work plan, a series of practical activities to achieve our goals.